Hey everybody, a quick video regarding the musculoskeletal system. If you go to your next step textbook, this one, chapter 8 is the musculoskeletal system. I'm looking at page 309 right now, the very beginning of that chapter. Starting out at the top of that page, it says, we know common musculoskeletal complaints. Pain in the neck, it says, the knee, the shoulder, the wrist, the elbow, the hand, all of these areas. Conditions commonly related to our musculoskeletal system then are sprains, bursitis, strains, tendinitis, dislocations, fractures, nerve entrapments, and even gout. A physician who specializes in the diagnosis and treatment of these disorders of our musculoskeletal system is an orthopedist. An orthopedic surgeon is one who not only will diagnose and treat those disorders for us, but then will also perform any musculoskeletal procedures that we might need to have. And they talk about any implants, things like that we might need to have. Under arthrocentesis, arthrocentesis is the first area here that we go through. And I have a lot of writing and highlighting here kind of on this page in my textbook. If you can see, I have a lot going on there. Arthrocentesis is the injection and or aspiration of a joint. Okay, it says it's commonly used for joint conditions as a treatment. A needle is inserted into that joint to first anesthetize it. Drugs like Depomedrol or cortisone can then be injected into that joint. Or, and that's a really important little tiny word there, or fluid can be withdrawn. So you can do the injection and put the medicine in it. Okay, it's the same code. You can take fluid out. You can inject and take fluid off because there's excess fluid on that knee from overuse or injury, and then put medicine in. It's kind of like two different things. It's still the same code. Okay, and or, so it's injection and or aspiration. So aspiration is withdrawing that fluid. Injection is medicine, a corticosteroid, something like that into the joint. Either way, they're the same code. And then the next sentence there says, bundled into the arthrocentesis is then the dual services of injection and aspiration. So either one of those, you're still going to get the same code. So for example, code 20610 is reported when your physician will withdraw fluid from the knee and then inject Depomedrol. Okay, so we withdrew the fluid and then we put the medicine back in its place. The drug that's injected comes from our HCPCS books. Okay, HCPCS is something that, a whole lesson that we're going to get sooner than later here in the semester. It's a whole other book, a whole other way of coding. You have your ICD-10 book for your diagnoses, right? You have your CPT book for your procedures, right? You have the PCS, right, which is for procedures on the hospital side of things. HCPCS is all drugs, biologicals, and supplies. So if you give out casts, if you give out crutches, a wheelchair, a walker, a splint, things like that, that will come from the HCPCS book. All those HCPCS book codes start with an alpha. They start with an alpha. Okay, so that's kind of how you can recognize them and what book they come from. The other thing you find in HCPCS is drugs and biologicals. The substance that's in that vial that gets injected into you, or the substance that's in the bag that flows through the IV and into you, the substance or the medicine is what comes from our HCPCS book for coding. Okay, and that's what they talk about here. It says when you're reporting the drug with the HCPCS code, it's necessary to translate the brand name into a generic name. Okay, we use our drug books a lot when we're looking up drugs and biologicals in the HCPCS book because all the providers want to say all their brand names, right? There's so many brand names maybe for the same substance, but in your HCPCS book, everything goes by generic names. Lots of times we don't know. We have to look it up. Okay, so they talk about that in there. They talk about if you do fluoroscopy, CT, or MRI as guidance, you code it separately. That will come from the radiology section or a 7 code. All of these musculoskeletal codes will start with a 2. okay? And it's a lot like integumentary. It's just deeper. We have to think about how deep we are on if our code's going to start with a 1 from the skin chapter or if it's going to start with the 2 from the musculoskeletal chapter. They talk about tendon injections at the bottom of that page 309. If you turn the page 310 talks about fractures, different types. We have closed fractures, we have open fractures, and really the rest of that is talking about the diagnosis coding of them. So that's more Shelley type work there. We kind of skip over that. Case 8-1 is an orthopedic consultation. So we have an E&M visit there, consultation, right? So we need to decide whether it's an inpatient consultation or outpatient to find our code. And if I look at this just really quickly, it says outpatient clinic. So it's an outpatient consultation. So we have an E&M code, okay? Then it looks like they elected to inject the tender area over the right humeral epicondyle with Depo-Medrol 80 milligrams, okay? So they did that joint injection, okay? Arthrocentesis with the injection and or aspiration. So they went into the elbow and they put some medicine in there. They didn't withdraw any fluid, doesn't look like. It looks like they just put medicine in there. So you would have a code for your E&M consultation, a code for your injection, okay, of the joint, and then a HCPCS code, which would start with an alpha then for that medicine, that 80 milligrams of Depo-Medrol. We got to bill that out. Okay, you kind of have 3 things going on in that one. There's also, it talks about x-rays. We could bill out x-rays, radiology, that would start with a 7 as well. Fixation is talked about internal, external, percutaneous. It's good for you to read through that. On page 311, that main big paragraph here right before the end of the page, it says both application and removal of the device are reported just with one code. But what that paragraph goes on to say is if you have another doctor remove, you can code that. If it's the same doctor that puts it on and takes it off, it's all just one thing. Okay, if you go to a different provider or you have a different provider, maybe your provider's on vacation. I mean, there's lots of situations why it might happen that way. We can code it separately. Okay. Excision is talked about on page 312, and I think I referred to this page in some of the typing that I put in the content. This really shows you if we're more extensive and deep, our codes are going to start with a 2. For musculoskeletal, we need to know how far we're going when we're removing, okay? Or if that lesion was on the muscle, okay, obviously it's going to start with a 2. If the lesion was on the skin and we had to get cut it out and we cut all the way down into the muscle to get all of it, like if it had a root, okay, again, that's going to come from a 2. There's not much. There's a lot of great examples. And again, these cases that come from the textbook, you have all the odd number cases in the back. So it's good extra practice if you want to work on these. I usually don't assign these. Sometimes we go through them together in class. Repair, revision, and reconstruction is on page 317. You can read about that. Nothing too exciting. The sprains and strains down at the bottom of page 317 is all Shelley diagnosis type coding, which we don't get into, here in CPT. Late effects, again, is more ICD-10 coding on page 321, so we skip that. And we finally get to fractures, and we went through fractures last year. We don't get new types of fractures. I mean, this is all the same type of information. It's really good to make sure you read through page 322 and actually understand that it doesn't matter what type of fracture it is. You can't associate the type of closure with what type of fracture it is. If it's a closed fracture, doesn't mean you're going to have closed treatment. You might have to open it up, okay, to put pins and screws and things like that. So they don't always go together. You need to pay attention to that. Let's see. I'm just turning the pages here. Amputation is talked about. Has a tiny little paragraph there. Arthroscopy kind of has a big deal. It's great that you should read through arthroscopy on page 328. Just looking to see. I think that's the end of the chapter. There isn't really anything new here for this chapter. Again, if you have any questions or have any concerns or issues that you want to talk through, let me know. You can use message board, or the discussion board, I should say. The general questions is always a good one too, because if I can answer your question, a lot of times it can help someone else. So just let me know if you have any issues, okay?